Welcome back. Baking soda, a basic ingredient often found in your kitchen, has numerous health benefits. It can support digestion, reduce inflammation, alleviate joint pain, and improve sleep. Surprisingly, over 350 million people worldwide suffer from conditions like arthritis, digestive issues, and acid reflux, while millions more struggle with poor sleep, chronic fatigue, and kidney problems. Drinking baking soda water at night may offer real relief. In this video, we will explore the science-backed health benefits of baking soda water, how to prepare it, the safe dosage, and the duration needed to see real benefits. Watch till the end to learn the proper usage for maximum effect. Number 1. Support kidney functions. Sodium bicarbonate supplementation can aid kidney functions for individuals with chronic kidney disease by addressing metabolic acidosis. Metabolic acidosis occurs when kidney can't excrete acid or conserve base, accelerating CKD progression. Sodium bicarbonate helps stabilize the body's internal environment, potentially slowing kidney function decline. A 2021 study in Frontiers in Pharmacology found that this treatment increased serum bicarbonate levels and slowed the decline in estimated glomerular filtration rate, indicating improved kidney function. There was also improvement in vascular endothelial function, important for cardiovascular health in CKD patients. Administering these interventions during nighttime can enhance efficacy, but must be done under medical supervision to tailor treatments and avoid complications. Number 2. Alleviate gout symptoms. Gout is a form of arthritis caused by uric acid crystals accumulating in joints, leading to severe pain. Sodium bicarbonate combined with benzbromarone can help manage symptoms by increasing uric acid excretion. A 2024 study in the British Journal of Hospital Medicine shows the patients using this combination experienced reduced serum uric acid level and improved kidney function compared to sodium bicarbonate alone. Sodium bicarbonate alkalizes urine, increases uric acid solubility, and enhances excretion. Benzbromarone complements this by helping kidney eliminate uric acid. This treatment required medical supervision due to potential risks like metabolic acidosis from excessive sodium bicarbonate intake. Number 3. Balance body's pH. Bicarbonate ion plays a vital role in buffering excess acids to maintain balanced pH levels in the body. A study from the Journal of Nutritional Biochemistry explored the effect of bicarbonate-rich mineral water on acid-base balance, showing that consuming 1.5 to 2 liters daily increased urinary pH and reduced acid excretion. Bicarbonate-rich mineral water can support pH regulation, assisting buffering system during high acid load periods. Although the body has a mechanism to regulate pH, dietary bicarbonate can be an additional support, particularly for those with acid-forming diets. Number 4. Managing urinary tract infection. Urinary tract infection involves natural remedies like sodium bicarbonate. UTIs thrive in acidic environment, causing burning sensation. Sodium bicarbonate, an alkaline substance, can alleviate urinary pH, potentially reducing bacterial growth and discomfort. A study showed oral sodium bicarbonate increased urine pH from 5.31 to 7.2 over 4 weeks, reducing urinary frequency and urgency. While promising, excessive intake can lead to health issues. Consult with healthcare professionals before using this remedy to ensure safety. Number 5. For heartburn and acid reflux. Drinking baking soda water at night offers powerful health benefits, primarily in relieving nighttime heartburn and acid reflux. Sodium bicarbonate neutralizes excess stomach acid, providing relief from heartburn. Studies show bicarbonate-rich mineral water significantly alleviates heartburn symptoms. However, for persistent symptoms, consult a healthcare professional as chronic acid reflux may indicate conditions like gastroesophageal reflux disease. Always use these remedies cautiously and under medical guidance. Number 6 reduces muscle soreness. Sodium bicarbonate is a common kitchen staple with benefits for muscle recovery. After high intensity exercise, muscles accumulate hydrogen ions, lowering pH and creating an acidic environment, leading to fatigue and soreness. Sodium bicarbonate serves as a buffering agent, neutralizing this acidity. Research from the Frontiers in Nutrition indicates that sodium bicarbonate supplementation improves the recovery by stabilizing the body's acid-base balance post-workout. Taking it during recovery enhances blood bicarbonate concentration, fostering a better environment for muscle recovery and potentially improving performance in subsequent sessions. Number 7. Prevent cancer. Sodium bicarbonate, commonly known as baking soda, has potential in cancer therapy. A 2024 study in Frontiers in Oncology found that sodium bicarbonate can neutralize the acidic environment around tumors, possibly inhibiting cancer progression. Mice with malignant ascites showed extended survival rates when treated with sodium bicarbonate solutions compared to control groups. Additionally, a case study revealed a patient with chemotherapy-resistant ovarian cancer had significant reduction in tumor markers and acidic fluid after sodium bicarbonate treatment. These findings suggest sodium bicarbonate may impact the tumor microenvironment, reducing cancer cell survival and proliferation. Further clinical trials are necessary to understand its implication and safety. Always consult healthcare professionals before considering alternative therapies. Number 8. Relief from rheumatoid arthritis. By drinking a mixture of baking soda, anyone can get relief from rheumatoid arthritis. Rheumatoid arthritis is caused by an overactive immune system attacking healthy joint tissues. Researchers found that baking soda could shift the body's immune response from pro-inflammatory to anti-inflammatory, potentially reducing inflammation and pain. While baking soda is not a cure, it may help manage symptoms. Consult a healthcare professional before starting any new treatment. How to take baking soda. The ideal time to consume baking soda is about 1 to 2 hours after your last meal, right before bed. This allows your stomach to settle and reduce the risk of acid buildup overnight, which is often the trigger for discomfort, especially in cases like arthritis-related inflammation or acid reflux. As for the dosage, half teaspoon or about 2.5 gram dissolved in a glass of cold or room temperature water, 6 to 8 ounces is considered safe for occasional use by most healthy adults. Stir until it's fully dissolved and sip it slowly. For potential anti-inflammatory effects such as rheumatoid arthritis support, use consistently for at least 2 weeks. Long-term daily use is not recommended without medical supervision due to potential risks. For general wellness, 1 to 2 times a week may be sufficient and safer over the long term. Used mindfully, this kitchen staple can become an effective part of your wellness routine. Small doses, big impact. Be cautious if you have high blood pressure, heart conditions, or on a sodium-restricted diet. You should avoid it. Baking soda high sodium content can disrupt electrolyte balance, causing muscle cramps, weakness, and potentially worsening heart issues. Pregnant women must consult their doctor since it may affect their blood pressure and cause fluid retention. This is all about baking soda. Don't forget to like, share, and subscribe for more informative videos. Thanks for watching, and as always, take care of your health.